One of the newer technologies we have at this clinic is by a company called InMode, and they produce a machine that does the tight procedures, body tight, face tight, AccuTite. These are basically all the same procedure that uses radio frequency energy to heat up the skin and tissues to a very specific temperature to cause cellular and structural changes to those tissues. The end result is it firms and tightens the skin. It's a great new technology because it can be delivered in a minimally invasive way. So in the past, all treatments where we wanted to tighten the skin required skin removal, long incisions, long scars. Now we can use this minimally invasive procedure where it can be done under sedation or even sometimes local anesthesia, where we introduce a probe, it heats up the tissue to a very specific level and tightens up the skin. Patients can get back to work sometimes the next day or often after 2 or 3 days after the surgery. They start to see results after a month and they get full results after 6 to 9 months. And it's really good for very specific areas. So for people that have a little bit of loose skin on the underside of their arm, it's a great way of dealing with it without getting a scar. And also for patients, whether they've lost weight or after a few years, they have a little bit of loose skin around their neck area. They feel that their jowls are starting to come down a little bit, but they don't want to go through a whole facelift with a long scar, a long recovery time, lots of swelling. And they just want the lower part of their face a little bit firmed up. That's when we use FaceTite. AccuTite, which is another part of that technology, an even more precise and smaller version of that. It's for little areas where there's a little bit of extra skin, such as the nasolabial fold, or the fold that goes down just on the side of your nose and cheek. It can also be used for the lower eyelids and upper eyelids to firm up that skin as well, without having to have a long scar and a long surgery. Again, this is all case by case. It's not something that can be good for every patient and every person. When you come in for consultation, we evaluate the body part in question, and then we can recommend what we think is the right treatment plan for you.